Thank you. Okay, so welcome again to our webinar today on at-home-based therapy. My name is Amber Zeuner with the Miller Elder Law Firm. We also have Jo Lisa Byers here as well as Tyler Owens. If you guys could just introduce yourselves.
I'm Jo Lisa Byers. I'm an elder care coordinator at the Miller Elder Law Firm. And I'm kind of excited to bring out some information that I didn't know, doing what I do. And it's kind of interesting to find out more. And we have Tyler.
Yeah, I'm Tyler Owen, I'm a physical therapist assistant, practicing for about years now. Local Gainesville native, went to Santa Fe College right down the road. Been practicing in all different settings: hospital, outpatient, skilled nursing, therapy in the home, and skilled nursing or home health. Get really excited here to talk to you guys about the differences in therapies and what we can offer for you and your loved ones.
Wonderful. Yes, I'm really excited about this conversation. As we were saying just a little bit a minute ago, it's something that comes up rather often in care situations and trying to find what works best and what coverage works and how to get that services and care that you or your loved one needs. So let's go ahead and jump in then. As we said, today our conversation is at home-based therapy. So to start off the conversation, what are some typical services that we'd see under that home-based therapy? And
So
I think,
typical,
go ahead.
all good.
Apologies.
Okay, typical services for therapy specifically, you're going to see physical therapy, occupational therapy, and speech therapy are the primary three rehab therapies that we'll see in the home setting.
Wonderful. And as far as how we might go about getting those services, Jo Lisa, I know we had a number of questions on that for questions that are usually given to us as well on how to go about getting that. So what does that look like? We know there's Medicare, we know there's Medicaid, there's various A, B, C, Ds on Medicare. Let's go ahead and start there. I think that's where a lot of people kind of have questions. Go ahead. I think Tyler, you have a broad knowledge on this one. So let's go ahead and start with you on this one.
Yeah, so definitely you want to go over different types of Medicare. Like you said, there's all different ones. Sometimes it gets a little confusing as to what falls under what. So yeah, basically the easiest way to put it is your Part A services are going to include when you're in the hospital, when you go to rehab, as well as traditional home health care in the home. The home health care specifically under Part A typically includes nursing, as well as the rehab services that I just spoke about. The PT, OT, speech can also include services like social work as well. So that Part A services are really, just in the beginnings of the rehab process when nursing is needed. Part B, on the other hand, is considered outpatient services. So that's what we here at TMC Therapy provide. What we do is strictly just the therapy, PT, OT, and speech therapy, and we're able to offer more therapy under the Part B services, and typically longer therapy sessions at a higher rate. So really finding what's appropriate for you and where you fall under, if you're more ready for Part A or if you're ready for Part B, and knowing the differences. I'm sure we'll go into more about that.
Yeah, certainly. And I think we were talking as well about how one kind of bleeds into the other when it is time to go from Part A potentially to Part B, maybe. And let's go ahead, Jo Lisa. I know that you had some other real good questions we talked about related to what that looks like.
Yeah, I was really curious about somebody's in the hospital and they get discharged with therapy and they go to, let's say they go outpatient therapy. So they're at home, but they're going to a rehab center. Do they have to, is that called home health because there's a nurse coming to the home? Because if they get therapy and plus nursing. So is that called home health or is that called therapy? That's my question.
Yeah, so if they're receiving services in the home and there's a nurse coming to the home, that's considered traditional home health care, which would be under Part A services.
Right. And so they're under Part A services for however long. And then they can, if they need more therapy, they can go to Part B for
Yes,
therapy.
yes, for follow-up, once nursing isn't needed, Part B can follow up right away. And also, if nursing isn't needed in the beginning, a big point that we bring up is that a lot of times patients are referred to home health not needing that nursing service when they could just skip it and go to Part B outpatient therapy and receive more therapy services right off the bat rather than waiting.
Okay, so what you're saying is if they go to home health, a home health company, and they go to get home services, they're not going to get, if I understand this correctly, they're not going to get 3 days a week, or they may start out that way and then it decreases. Is that correct?
Correct. That's traditionally what happens under Part A. They're typically looking more at just getting the patient set up in the home, making sure they're safe. Um, they're not going to be looking at specifics. So, for example, under Part B, we can look at more specifics as far as gait training with progressing assistive devices, more in-depth manual therapy techniques. So there's more we can do, and we can provide it at a higher frequency rate for longer therapy sessions.
Yeah. And I think that actually goes into a question that we get often, which is as far as, the part A, the part B, like I mentioned, we talked about maybe one bleeding into the other. I think, Jo Lisa, you had mentioned this, but how services can decline in part A. And so when it may be time to actually bring up maybe going into part B and not needing that nursing service, the side of nursing anymore.
Right. Yes, and that's one of the concerns, is because sometimes people at home don't know that they can get more services. They can go back to their doctor and say, listen, I need more, I need to be stronger. And the doctor can write a prescription, and then they can contact the therapy to get PT, OT, CT, or whatever, speech therapy. So that's one of my, they kind of stop when they finish A and they finish their therapy. It's like, okay. And it's like, wait a minute, they're not moving. They're not getting out of their chairs. They're not steady. We need more therapy.
So I think going into that, how do you often see, I guess, going about getting that more therapy, transitioning from A to B and what that process is?
Yes, and going off what Jo Lisa was just saying, so often we get plenty of patients that come to us after receiving home health and not knowing um, the differences between the two, and that they could have probably had more therapy sooner if they had known and seeing the difference. So yes, so to answer your question, Amber, to go from Part A to Part B, um, once Part A is officially discharged, Part B can follow up right after. We would just run insurance verification, check everything is good there, and we can start. We do try to get a doctor's order, but here in Florida, we can go up to 30 days without the doctor's order. And then once that 30 days is there, then as long as the doctor's signing off on the PT's paperwork, then we're okay to continue services.
Wonderful. Okay. And then, not to steal from you, Jo Lisa, I apologize.
Okay, go ahead.
But what are there any goals, requirements, things of that nature to switch from A to B, or even once you're in B? Is there like a qualification for that?
No specific qualification. The main thing goes back to nursing, just making sure there's no, for example, wound care needed, any IVs, significant medication management. As long as the patient's, going to be safe in the home, from a nursing standpoint, there's no reason for them not to be going to try and Part B services. And like we talked about a little yesterday too, when we were discussing this, was that if a patient does come to Part B services, and say, for example, if they do come up with a nursing need, for example, if a wound opens up or they do need to go on IV antibiotics, for example, there's no reason why they can't just take a brief pause, go to a home health agency for nursing care, let the nurse take care of what needs to be taken care of, and then come back to Part B outpatient for your therapy.
Okay. Wonderful. And then I want to circle back actually. So we're talking a lot about getting the therapies, how to get those, what you may or may not want to look into getting. But we talked about PT, OT, speech. What does that look like as far as the therapies themselves that are offered, and how that would go about helping someone, how many times a week or what they may be able to get?
Yeah, so with us at TMC Therapy, we definitely try to err on the aggressive side, when needed, and to provide the therapy that's needed for that patient. It depends on the diagnosis and the individual, of course, for everyone and what's
Of
needed. And as far
course.
as the length of time that's going to be needed, we have patients, that are coming after, for example, a total knee replacement, and they had a, really high prior level of function. They might only need a few weeks of therapy, and then we set them up with the home exercise program, and off they go. They're good to go. But on the other hand, we do have the other side of the coin is we have, patients who are in their 90s or they have a progressive disease or neurological problem that's going to take a lot more therapy. And it's really just going to be a long road ahead for them. And we want to be able to provide them the help that they need as well. So there's really both ends of it. So we try to meet the patient and what their needs are to get them to their goals.
Wonderful. We do have a question here. I think this flows right along with our conversation. How long can you get in-home therapy sessions under Medicare Part B?
Yeah, that's a great question. So under Medicare Part B, ultimately it's up to the evaluating therapist to determine what's justified. For us, it's typically around 6 months is what we're looking at for the most to keep people on for. That's not, a super strict guideline, but it's just kind of what we follow. But there's usually a certification period when a therapist comes to your home, they evaluate you. It's typically a 2 to 3 month certification period. After that 2 to 3 month certification period, they'll see how you're progressing. If you've met your goals and you're appropriate for discharge, we can recommend a discharge. If you haven't quite met your goals, but you're still making progress, okay, let's justify that and see what we can switch up to meet those goals in the next 2 to 3 months. But also at the same time, let's say you haven't met the goals yet, or you have, but you've started to kind of plateau, but you or your family members really think you still need that skilled therapy coming to the home, and without it, you would decline, you'd probably be back in the hospital. What we offer is called a functional maintenance program. This is also under Medicare Part B. We're able to offer their patients up to another 2 to 3 months of therapy. And the purpose is to maintain their current level of function and prevent decline. So a lot of different pathways. It just goes back again to the individual, but really we're going to do the best we can to find what they need and getting them to their goals and making sure we're not just cutting them off when they don't feel ready to be cut off.
Yeah, very individualized is what it sounds like between the goals and the therapist and doctors who are recommending the services. Okay. Jo Lisa, go ahead. Did you have any other questions on this topic?
Yeah, I do. On the Medicare Part B, so you have somebody, you've come through 2 cycles of 3 months, and they're still slowly improving. Can you still get Medicare Part B, or is there a limit?
There's no specific limit per se. With us at TMC, usually after the 6 months is when we kind of decide to come up with a game plan of what we need to do. Your options at that point would be to discharge with the home exercise program, or to continue. We do offer self-pay, if you wanted to continue that. But what I typically recommend is just trying to discharge for about a month, and then we follow up about a month after, see how they're doing, checking in with a phone call. If they indicate there's been any decline, hospitalization lately, or anything that indicates more therapy being needed, we'll work with them to try to get a new order from the doctor and getting started again. So at the end of the day, we do want to promote that independence and trying to get them, as much as they can on their own or training a caregiver. But if they do need that extra therapy, we'll be there for them.
Beautiful. I think that leads us into our next topic here, Jo Lisa, unless you had another question.
No, I don't.
As far as we've talked a lot about how to get the services, what it may include. But there are different companies out there who are offering this service, different at-home therapy networks. What are some good insight topics to ask questions when you're looking for a company who does this, or just generally when you're trying to find the best service for you?
Yeah, that's a great question because I've had people ask me all the time, if you're in the hospital and you get approached by a case manager or social worker asking about, follow-up, what's the plan once you go home? That can be such a nervous thing to think about. What's life after hospital? What's life after rehab? What kind of modifications am I going to have to make? And ultimately, your home care team is going to be the one helping you with all that. So you want to make sure you're getting paired up with the right team that's going to help you guide you through all of these, not only with you, but with the whole family. It's not just the individual always. So things to look at are definitely, honesty, that they're being transparent with you,
Yes.
checking insurances, things like that. And then also just ask about specialties. That's a big thing that I push for, is asking if that agency or company that you're going to go with for home care has experience with your diagnosis. And working with that type of person. It's a big indicator rather than just going with whatever name you hear first.
And I think we
sorry.
Go ahead.
So Tyler, so you're saying that there are, for different diagnoses, there are different physical therapists that specialize in, let's say, if it's Parkinson's, they specialize in helping the Parkinson's patient? Is that what you're saying?
Yeah, absolutely. All of our therapists here at TMC are very well trained and skilled. They can treat a variety of diagnoses with no problem. But at the same time, we do have people that are specialized in certain things that can give that additional insight. So, for example, we have DeAndre, physical therapist who is certified in Parkinson's care. We have an occupational therapist who's certified in lymphedema care, and we've worked with a company to try to get lymphedema pumps set up with patients also under Part B services, as well as some vestibular. DeAndre is also certified in vestibular therapy. So we have some experience in that as well. But it's all about asking those questions from the beginning to make sure who you're getting set up with is comfortable treating that diagnosis.
Yeah, and if they have the most experience to do so, that's a really important conversation to have. Jo Lisa, did you have another one?
We did have another one. I have another one. If you, let's say I go to an ALF and they don't have physical therapy there, but my client needs physical therapy. Can I get a prescription and you guys come to the ALF for therapy?
Yes, absolutely. We can go to independent living facilities, assisted living. We've also seen people even in adult daycares in the community. And that's also a limitation with traditional home health. A lot of times they aren't able to see people that are actually in community centers like that. Because with traditional home health, you have to fall under what's called a homebound requirement. Meaning that you can be you're homebound, you can't drive, you can't go to places regularly. Whereas under Part B services, you do not have to be under the homebound requirement. So we can see you wherever you may be staying at.
We've got a couple questions here I do want to bring up and just address. So it looks like, as far as coverage for Medicare Part B, I think that's really going to depend on the services and what you're asking for. I think that's going to have to run through insurance to see what they're going to cover before we give a specific number here. But is there something particular that people can reach out to figure that out ahead of time for therapy costs that you might know of, Tyler, or a way to kind of get an idea ahead of time?
Yeah, I was just looking at that question as well. So for Medicare Part B, no, it does not cover 100%. We do know that. Medicare Part B will always cover 80% of an outpatient cost. The other 20% is picked up usually by the patient's secondary insurance if they have it. If not, then that 20% the patient would be responsible for. Here at TMC, we do also offer financial assistance help with patients that are interested in that and filling out an application that we review.
Yeah. I think it's going to come down to actually figuring out what you need, though, perhaps, and running the numbers to see exactly what your quote may be in the long
Mhm.
run. Okay. And then let's see here. I think the next question that we wanted to ask actually was, what happens when there's no more therapy? So you've gone through part A, you've got certified, you've went through part B. Now part B is ending. Is there a way to continue therapy if you think that you still could use some more assistance?
Yeah, so at that point, even if you've gone through all of part A, all of part B, you've discharged from part B, your options would be we do offer a self-pay option. So if you did want the therapist still coming to the home to work with you or a loved one, we offer self-pay services. But we also, before even we get to that point, we try to do our best to try to find alternatives to get that patient moving to some degree, either whether it's training a caregiver, trying to get them involved with their local gym or dance classes, all of those. We try to find resources. I know I've even reached out to you guys and even like Laura Monday to try to find some community resources for our patients to get them up and moving as much as possible.
Yeah, no, that's definitely something we love to help with. Okay. So the so essentially, if you've gone through your insurances and you need more therapy, you may be looking at private pay as an option that's available to you.
Mhm. And that's typically not something that is offered by the traditional home health cares, but under our company at least, we are able to offer that self-pay.
So it's going to depend on where you go as well and what their unique services may include.
Correct.
Mhm.
Okay.
So I also was in a situation where somebody was placed under hospice, and your company had been there, and she got placed under hospice. Well, hospice doesn't allow, because they're on hospice, they're not going to be brought back to any kind of, I don't know how to say this, but their physical ability was going down. But I needed you guys to come in and talk to them and work with her. But we couldn't do it under Medicare because of the hospice situation. But I was just trying to get her up out of bed so that she didn't lay in a bed all day long. And I did contact Tyler, and Tyler, what did you do for me?
Yes, yes. So hospice patients are kind of a case by case situation where it is a tricky situation where Medicare isn't going to no longer pay for any type of therapy services once you're under hospice. But what we try to look at is the individual case and to see really what they're looking for. So in this instance with Jo Lisa, she had somebody that really was just going to be bed bound. Even though she was on hospice, she still had a relatively long prognosis as far as life went. And she had 24-hour caregiver service. And the patient really wanted to get out of bed. She wanted to be in her wheelchair. She wanted to be in a recliner chair, mobile, but she was just not safe for those caregivers to get her out of that bed safely. So where we came in is we were able to come in twice a week and have a skilled therapist help her safely transfer out of bed, rolling, scooting, sitting up, and transferring into the wheelchair. And then also getting involved with the caregivers, educating them, and taking her outside for walks, getting her to a recliner chair, having talking with her, sitting up, playing some games, having a ball toss, etc. It's about quality of life and making sure that that's what they want, the family members want, and making sure it's safe is the main thing.
Yeah. That's always our priority, especially with therapy and, just trying to get improvements on those activities and moving forward, essentially.
Mhm.
So I do see another question here related specifically to TMC and what they offer. And I do want to continue our conversation as far as what may look like, what types of therapies may look like in the home. But I think if you have any questions for Tyler or TMC, they'd be happy to take a phone call or some other communication when you're available. And his information will also be available at the end for you to take down and do so. And then more particular questions, I think they can answer on that front. But
Yeah.
go ahead.
Yeah, absolutely. Any questions, feel free to reach out to us, especially when trying to make that choice of, part A or part B. It's good to sit down and just talk, pros and cons of both. I always tell people, if you do end up going with part B and starting out with more therapy, if you do feel like you do need the nurse, you can always go back to part A. Same thing with part A. If you feel like you're really just not getting enough therapy, you ask yourself, how often is the therapist coming into the house? How long are they spending with me? How many different therapists are coming in as well too. All those are great questions to be asking, and might bring up the topic of switching to part B.
Wonderful. So I did want to get into just what those services look like at home. So for physical therapy versus occupational therapy or speech therapy, Jo Lisa, Tyler, I know we were talking a little bit about types of therapies, practices. You mentioned trying to teach some loved ones or people at home how to help them with these. What do those kind of look like? Is it, or I don't know. That's why I'm asking.
Yeah, it's a big variety. We can help with so many different things, and that's what I love about it. Is that if anybody with any type of limiting mobility, even us, on the younger spectrum with low back pain, knee pain, you name it, so many people can benefit from therapy in so many ways. So I love coming in and just sitting down, talking with people, seeing what's going on with them, where they were at prior level dysfunction, where they want to be at, and finding out realistic goals and working with them. So at least on physical therapy specifically, we're doing a lot of walking, strengthening, balance work, etc. Under occupational therapy, we're working on activities of daily living with the patient. So whether it be showering, bathing, dressing. Specifically under Part B, what I love highlighting about occupational therapy is that we're able to work on a lot of higher level things that home health doesn't usually have time to go over. So for example, we had somebody who came to us. She didn't really think she needed occupational therapy so much. But when we really sat down and started talking, I started asking her, what activities were you doing before that you aren't able to really do now, that you have trouble with? And it came to find out she was a huge gardener. She loved gardening. She had a huge garden in her backyard. She loved cooking. She cooked for her whole family, 3 times a day. She come from scratch, baking, everything. She showed me her whole baking set. So I thought it'd be a great idea, even though you can get dressed, you can do showers, that's awesome. She didn't think she needed it, but I said, let's just go ahead and try the OT, just at a higher level, working on more advanced things. And she loved that, and the therapist was actually out there in the garden working on body mechanics, having her reach down, picking weeds, as well as, working on baking, reaching up high. Sidestepping, there's so many things you can do with therapy and just getting creative, and especially in the home setting, you're really able to see functionally what that patient needs to work on. And then speech therapy as well, they have their whole own world where they do working on cognition, swallowing, and speech. Well, they're kind of like, they don't get so much credit, but they do play a vital role when needed for speech therapy.
Certainly, yeah. I think that's what we often experience on our end with the cognitive and speech, as well as the physical and occupational too, though. Jo Lisa.
Yeah, the speech therapy is really important because there's people I see, they drink something and they start coughing, and okay, you do it once, but every time they put something in their mouth and eat or drink and they start coughing, there's an issue. And so speech therapy has been great in evaluating, do they need thickened liquids? Do they need pureed foods? What do they need? Because that coughing is probably going to lead to sooner or later, it's going down into the lungs and it'll be pneumonia probably. That's why I think that speech therapy is pretty important for people.
Yeah, even like you said, you
Yeah,
wouldn't necessarily know that you need it. It's just a cough, or you're just having a tickly throat. Okay.
yes,
Um,
definitely. And cognition as well is a big thing with speech therapy that a lot of people don't remember too. Is, for example, like dementia is a big diagnosis nowadays, and speech therapy can really offer a lot to try to, combat that ongoing illness, um, and get them, in training family members and making adaptations in the home as needed.
That's good.
I do see a question here asking about Medicare waiver. Would that allow PT or OT, or does it apply more to home care with feeding and bathing? I think we might be meaning Medicaid waiver, unless you have something else in mind, Tyler. But just to help answer that question quickly, Medicaid waiver is more so related to activities of daily living. You get home care to help you with that, making sure that you're essentially doing the activities that you'd have trouble with. Now, if PT and OT is under that, that's a little different. Do you want to address that real quickly, Tyler?
Yeah, Amber. So a Medicaid waiver is, I assume, what they're meaning. And yeah, that's different. That would be more considered a caregiver coming into the home, covered by a Medicare waiver. Us under outpatient Part B, we don't fall under that Medicare waiver, unfortunately, Medicaid waiver, unfortunately.
Yeah, it's a little bit of a different qualification. And we also have a number of other webinars. If any of the attendees haven't watched those previously on Medicaid, I think we also might have one on the different types of Medicaid as well, which would include Medicaid waiver. Those are all on our social media as well, to review and go back to. I think that covers our conversation today, really, on at-home therapy. Jo Lisa, was there anything else that we might want to bring up, or that we might see often that we haven't touched on?
Not really. We've kind of did a broad scoop of everything.
Wonderful.
I'm kind of glad that Tyler had the time to come in and just have this discussion, because it's a lot more than what you think. You just think I have to go to this and the doctor told me to go there and that's it. But there's more to it than that.
There's a lot of personal advocacy or family advocacy that comes in to make sure you get your services that you might be entitled to or you might need. Yeah. Thank you so much, Tyler, for joining us. Certainly, like Jo Lisa said, it was a pleasure, and taking your time to help answer some questions and help some people understand how it works is certainly a great benefit to everyone here today and who might watch it later.
And Tyler, you want to give us your information?
Yes.
Sure. Yeah. Thank you guys so much again for having me. It was a pleasure. But yeah, if you guys have any additional questions, or anybody watching this webinar has questions now or in the future, don't hesitate. Just call and ask. I love just even connecting with people, even that we can't help initially, getting them set up with the right person. I think that's so important. Even if we can't help somebody now, hopefully we can help them maybe in the future if needed. So I love just being the middleman and connecting people with the right resources. So if you need to contact us, my phone number is 352-756-2461. We have an email address is TMC therapy at home at therapymgmt.com. And then you can reach out to Amber, Jo Lisa, and they'll have our information as well. And we're also online if you search for TMC therapy at home. I have a link as well for more information.
Thank you so much, Tyler. I think we're about to wrap up then. Unless anyone had any further questions, like I said, we do reserve some time at the end, so go ahead and put those in now if you do. While we give a minute for attendees to go ahead and ask those questions if they may have them, just to reiterate, we will be sharing this recording as well shortly after we're done here today, and it will go also on our social media. And we'll go ahead and include that info when we send out the recording to those who registered for the video. Okay, for Tyler, that is. There was a request to put it in the chat, so we'll include that with the recording when it goes out. Okay, Any other questions? Not seeing any. Okay, I think we're ready to go ahead and wrap up here today. Thank you guys so much for joining us, and looking forward to how we can help you guys in the future, and potentially whatever our next webinar may be, and how that can help you as well. Okay.